Good morning. My name is Jatinder Kaur, Assistant Professor, Khalsa College of Nursing. Today I am talking about e-health. E-health is the use of communication and information technology in the healthcare sector. E-health is providing in the settings where there is no direct contact between the healthcare providers and the consumers or the patient, and the interaction is mediated through the electronic media. This project is launched by our Honorable Prime Minister Mr. Narendra Modi in 2015. The scope of initiation was that to provide the healthcare services to all the people all over the world all the time without any discrimination and with equity to all the people. So this is all about the aim or need behind the launch of this program. So this program is characterized by some E's in it. The first E is efficiency. So e-health or the digital health is very efficient and increasing the efficiency in the healthcare settings by reducing the cost of duplication and avoiding the unnecessary interventions. Next E is evidence based. Healthcare settings or the e-health involves the evidence-based interventions, or these interventions are evaluated by the scientific methods. So it improves the quality of care. Next E is enhancing the quality care. So the care involved or the care provided through the e-health is a good quality care as it compares the health care interventions provided by the different providers. Next E in is um, education. So the e-health includes the education also. It provides the skill training to the people all over the world, to the health education, to the public, to prevent their and promote their health and the prevention of the various health diseases. Next is the extending. Next E in the extending, it involves the scope of the healthcare settings in India. As we can see, there is involvement of the information technology is in the healthcare setting, so it is extend in this beyonds. Next E in this is enabling. So it enables the information and the exchange of the information and the communication between the healthcare providers and the consumers or the patient in a very standardized way. Next E in this is encouragement. So e-health is encouraging the communication between the patients and the healthcare providers, and it is building up the good relationship among each other. So this is all about the ease. One E is equity also. Equity means the healthcare provided through the e-health is very equitable to all without any discrimination. So e-health provides the care to the people at the remote areas without any discrimination among each other. Next, there are some types of e-health in India which are launched for the welfare of the healthcare services to the people. So, in this, the first type is telemedicine. Telemedicine includes the psychological and physical diagnosis and the treatment to the people at the distance area, basically to the remote areas. Next, launch the type of communication. So electronic health records, in this we saves the data or the records of the patients and the information about the patient electronically on the devices, so that it will be very easily and readily available whenever we need them in future. For example, a patient who is serving somewhere in the country can get his data electronically very easily from outside their reach. Next is the virtual health team. So it includes the health team members virtually, they collaborate with each other. For example, when there is a need for the online meetings or the video callings, they can contact with each other and they collaborate, or they do meeting through the video callings with each other and discuss about the important topics. Next E is computerized physician order. In this, a patient or the consumer requests to the doctor for the diagnostic testing and for the treatment and receiving the results from the physician. Next type is e-prescribing. In e-prescribing, here the doctor prescribes the medicines to the doctor, to the patients via through the pharmacist. So here he sends the e-prescription to the pharmacist electronically or with the help of internet. Next is tele-rehabilitation. Tele-rehabilitation, here the rehabilitation services are provided to the patient at the distance area through the online services. Next type is telesurgery. As the name is very interesting, telesurgery, it here there is a use of the robots for the surgery, and the wireless communication is there between the various specialized and various healthcare workers for the surgery purpose. Next is the teledentistry. Teledentistry, as the name suggests, there is a care provision for the promotion or the for the specially for the dental care. Here the images and the information is exchanged between the specialized doctors online or through the electronic media. Next type is telenursing. In telenursing, the health care provide to the people at the remote area is provided through by the nurses. Here we can use the internet, we can use the video callings to provide the care to the people where we can't reach. As a nurse, we can provide them a care through the telenursing. Next is the Helth. Helth, this is to collect the data from the public health data from the people in the community on the electronic devices like on the mobile phones and all. Next is, this is all about the types of e-health which are launched in our country, which we can use them, utilize them in our daily routines for the ease of our life. There are some benefits of this I would like to discuss with you. The first benefit is time saving. As we can see, on nowadays we are using the mobiles for any type of appointments with the doctor, to deal with the appointments with the doctor. So here the patient, for example, the patient can take appointments from the doctors from their home only. So by this they can save their time. They can save their time for the sitting in the hospitalization. They can reduce their these times. Next is the cost effective. We can say we can see we need to reach the hospitals, and the transportation cost is very high for the same. The people at the distance area, we can even in the foreign countries we can contact with the doctors through the electronic media, and it is also a time saving and cost effective. The next benefit is it is very easy to access the records of the patient electronically, and with the help of readily available data we can get from the devices, electronic devices. Next benefit is this is very easy to communicate with the other health workers, with each other for the purpose of the same. So if we want to contact with the other doctors, with the other specialists, we can contact them through the internet and electronic media. So next, it reduces the administrative burden also. So paper pen and the wastage of the paper pen can be reduced with the help of electronic media in the healthcare settings. So through this, the next benefit is this: through the e-health we can provide the health care to the people at the remote area at a very low cost. So these are some benefits of the e-health. Now next are the some limitations. There are some limitations of the e-health also. The limitations are, the first thing, it requires the skill training. The people who want to deal with it, they need to be required, they need to be learn the skills to handle the e-health services. Next, limitations are that the commoners can't use it because they don't know how to handle it. Next limitation is in India is there is a lack of IT infrastructure in India. So to launch or to establish the infrastructure, we need a huge money. Some ethical issues are there, that there is a chance of privacy hindrance through the electronic media. Next limitation is it can create the distrust between the patient and the physician because of the distance among each other. So these are the some limitations of this project. Otherwise, e-health nowadays it making the our country very easy availability of healthcare services to all the people all over the world. Thank you.